Let's Talk About Kidneys takes a deep dive into the chronic kidney disease patient journey. We're here to inspire meaningful conversations and to help people living with CKD gain a full understanding of their disease. Being diagnosed with kidney disease and having your very first visit to a new physician office can be a big deal. Listen to what to expect during your initial visit to our offices, where we are here to make your experience comfortable. Hello, Dr. Wiederkehr. How are you today?
Doing great, thank you.
Good. Well, we have another awesome podcast ahead of us, and I
Okay.
think it's super informative. It's going to let the audience, specifically the patients, know what to expect at their first visit with a nephrologist. So that is today's topic, what to expect at your first visit with a nephrologist. So, first question, why have I been referred to a nephrologist?
Well, that's a great question, and you wouldn't believe how many patients actually ask me exactly that question. Why am I here? It's sometimes it's clear, but sometimes it's not clear. I want to say very often it's a test that was abnormal in your blood work or in the urine test that was showed up as not being in the normal range, and your primary care physician, he or she feels like that needs to be seen by a specialist. That's the common reason. But sometimes it may not be in your kidney function. It may be something that's related to the kidneys. And it could be, for example, blood pressure. Blood pressure may be too low, but typically too high and cannot control it. Or it's a roller coaster blood pressure. It goes up and down, doesn't stay in range. It could be something simple but tedious, such as kidney stones that make your life miserable. And so it could be a variety of reasons. But typically, it's something that's either the kidney function or something that's related to your kidneys.
Okay, so today we're going to walk the patients through what to expect at the first appointment.
The first appointment is always a little bit longer. You can expect to be present for about an hour because I need to get to know you. I need to discuss some things that I could not quite understand from your records. Something that's specific about your kidneys that's nobody asked you before. And so I really have to kind of make a picture of your kidney health. And also, it's typically, the first visit, I have to understand your other conditions as well and how they may affect your kidneys. So it's much more broad, comprehensive, because the kidneys obviously are not just one organ isolated, they're part of your body. So, and we run typically blood tests and urine tests, and very often we need to get an ultrasound of the kidneys. We don't do this in the office, so we would arrange for you to have that done at an outside facility. And sometimes a kidney biopsy, but that's not typical.
Okay. And so do I need to bring paperwork to my first appointment?
Bring your paperwork, even though I want to say much more important is bring your medications, because sometimes your records may say one thing, but turns out the medications have been changed. It was not written in your record, was not changed in your record. So bring all your medications. There's also a form that's about 4 or 5 pages. That's your health history, where you write down the important things about your health history, like your previous surgeries, your medical conditions. And what's important very often is your family. Mom and dad. Are they doing great? Or, oh no, my dad had kidney problems. So that really helps us understand where you may be.
Okay. And so at that first appointment, will you automatically know all of my problems? Are you looking at my whole health history prior to, or is it something we're discussing along the way?
So it's a combination. But the nice thing about practicing and living in 2022 is that we have electronic health records, which makes it very easy for me to look up your records. That's all personal information that's protected. It's not public information. But as a physician who's seeing you for a reason, I'm permitted to access your records. I always look at your records the day prior. I spend a lot of time looking through your records to understand where you're coming from, what's going on now, what do I need, where do I come in. But it's not always the whole picture.
Right.
Sometimes reading the records, it's like, why would it be this way and not that way? And so really meeting with you, and I spend a lot of time just talking to you because I need to get all the information and sometimes from your perspective too. That's
Yeah,
maybe
maybe some
different.
things that's left off
Yes.
what's, written down. So,
So expect to have a lot of conversations because I need to get to know you.
okay. And are there any additional tests that are going to be needed at my first appointment?
So uh, typically, yes. But again, the advantage of having access to your records, if you just had a blood test done a week ago and it was abnormal, that's why you're seeing me, I don't repeat the same test. So I can really focus on what has not been done, what I need to do in addition. Very often, it's maybe an additional blood test. Very often, it's urine tests. So make sure you can give us a urine sample. And often, it's also imaging of the kidneys. That's typically an ultrasound, sometimes a CT scan. So there's things that we need to get done, usually not urgently, but we have it arranged at an outside facility.
Okay. And I know you mentioned this earlier about bringing my medications to my first appointment. Talk to me about why that's so important. I know some people may have a whole bag of medications. Some people may want to memorize it offhand, but why is it important to actually bring them to the appointment?
Because sometimes, not well, first of all, I need to double check. But sometimes you may be surprised that you find a medication that you were supposed to take and you didn't
And
realize you were
taking
not
it.
taking it.
Yeah.
So it's really a review, a comprehensive review between you and me about what am I taking, what am I supposed to take, why do I not take this medication anymore? Oh, this one always gave me a bad headache. That's why I stopped it. So it may be listed in your medication record, but you're telling me now that you're actually not taking it because you have a side effect. So going over each medication is very important.
Okay. And then is there an exam that is going to be done at that first appointment? I know you said the first appointment was going to take typically about an hour
Yes.
to sit there and go through and get to know you and go through your health history. But is there a physical exam that takes place?
We examine you as a patient, but it's a focused exam. So that your primary care physician may have you get into a gown and do a much more thorough exam. With the nephrologist, it's a more focused exam. We really want to focus on the kidneys and organs that are affected by the kidneys, like the heart, lungs. Check your legs for to see if you have good circulation, if you have swelling. So there's a couple tests, exams that we do, but it's typically much more focused than what your primary care physician will do.
Okay. Once I start seeing a nephrologist, are you going to replace my primary care doctor or will I go back to my primary care? Can you explain how that would work?
So the answer is never. I will not replace your primary care physician because I am basically a specialist that specifically looks at your kidneys and things related to your kidney function. But your primary care physician is still the main person, the captain of the ship that steers you the right way. And primary care physicians do things that we don't do in our nephrology office. They check some blood work that we don't typically do, like your cholesterol. Very often your diabetes numbers, we don't do that typically. And also things like make sure you're up to date on your shots, cancer screening, make sure that's all happening. So I'm part of your team, but I'm not replacing your primary care physician. That's very important.
Okay, so let's talk again about medications. I know that when I first started seeing a nephrologist, I was already on, I think, one or two blood pressure medications. So if I leave your office and you recommend or you prescribe another blood pressure medication, does that have to be approved through my primary care physician? Are you guys going to communicate?
We always communicate, and no, you don't. We don't have to get it approved because when your PCP sends you to me, he or she trusts that I'm seeing you for that special reason, and that I will make the changes as I find appropriate in my expertise. So I've never had a situation where a primary care physician would object to it. Very rarely is it an ambivalent situation where it's not quite wrong or right or wrong, and I would reach out to the PCP and talk to him or her. And if that happens, you will know immediately what the situation is. But much more importantly, we always communicate with your PCP. And this day and
Good.
age, it is so easy with electronic health records and messaging. By the way, all these the interaction, the communication with your PCP is completely private. It's protected. and by law protected. So anything that I'm doing and that your PCP does, we communicate with each other, but it's always through secure channels.
Okay. So after my first appointment, when will I be scheduled to see you again?
It really very much depends on what the situation is, what you have. If you have something that's more serious, that needs more urgent attention, I'll see you back very quickly, 1 or 2 weeks. I may even call you between that to make sure we're in the loop and in close communication. But it may also be something that you've had for years, and your primary care physician just feels like, let's just make sure the specialist is okay with this. And I may see you maybe just once a year, just to kind of stay in the loop and keep an eye on things. So it really depends. But I think as a rule, if you're a new patient with us, I would see you back in 2 to 3 months if it's something that's not urgent, and then less often depending on what it is. But the initial follow-up is typically sooner to discuss all the results.
So one thing I think we'll really hit on is the importance of being part of your care team. I know with my experiences over the last, 16 years with CKD and 2 transplants, I am zoomed in on communication with my healthcare team. One of the great medical professionals that Dallas Nephrology has is called a patient navigator. So can you explain what a patient navigator is and how that is an integral role to your care team?
Right. So DNA in the last 2 years or so, we really ramped up our navigators. So a navigator is typically a nurse who keeps all the loose connections together and make sure it's not loose and we're all part of the same team. She makes sure that if you have an appointment, a follow-up, it actually happens. If for some reason you miss an appointment, she will probably call you and say, was that what's going on? Make sure you follow up. And also, I think it's also somebody who basically has a checklist and make sure all the things that need to be done will be done. For example, a dietitian. With your CKD, with the chronic kidney disease, you really would benefit from seeing a dietitian of what can I eat or should I not eat? How do I help my kidneys? So in a busy appointment where we have to talk about so many things, we may not talk about the dietitian. And the navigator will say, Dr. Wiederkehr, the patient, I think, needs to see a dietitian. Oh, yes, absolutely. I'm glad you brought it up. So the navigator really makes sure we don't forget anything, make sure you follow up, make sure you have your appointments, just kind of keeps track of everything. And we've been doing it now for about 2 years, and it's been extremely helpful.
Right. So there's essentially no reason why a patient shouldn't be involved in their care, because that is the most important part of your, whether it's your road to recovery, maintaining your kidney functioning, is being involved in care. Do you agree with that?
Yes. Make sure part of the healthcare team, the most important person of that team is you.
Yes.
And communicate and talk, use the portal, but communicate with us and make sure you're involved and concerned. And if something's not right, make sure we know about it. Conversely, if you're really happy about a medication or a test and you want to communicate with us, let us know. So it goes both ways. I think the more we communicate and work together, the better it's for your health.
Okay. And so you mentioned the portal, you mentioned communication. So one of the components to that healthcare team is registering for the Follow My Health app. That is our patient portal that is offered through Dallas Nephrology Associates. I know that when my medications are changed, when I'm waiting for lab results and I know the physician is seeing other patients, I can easily log in and, see my results, see any medications, update my blood pressure reading. So can you talk to me how you have patients utilize the portal as well?
Yeah, I think the portal is really crucial. It's so important. And, it sounds a little tedious because in a perfect world, we all have one portal, one place to go to, one username, one password, but not quite yet. But we do have a portal that's DNA specific, Follow My Health. And yes, you have to set up. It's easy. We actually have a QR reader, and set it up one time, username, password. And once you're on that portal, you can quickly communicate with me. Any concerns, any changes, any side effects. Blood pressure medication doesn't work. I know immediately. I don't have to wait for 3 months when you come back and tell me, hey, it didn't work. That's 3 months that we lost.
Right.
So communicate with me. The portal has really made it so much easier. And also, you can look up your own blood work. We try to mail out the blood work to you. On the portal, you see your lab results. And if there's a question, you send a question. You send me the question. And remember, anything that's on the portal is private.
Yes. It's protected health information.
It's completely
Yes.
protected. It's not unlike an email. So don't use emails because it's not private. It's not protected. Use the portal. Everything on the portal is private, your information.
Okay. And so that kind of wraps up the questions that we have for you. But I think that we need to really hone in on 3 main topics that we discussed during this podcast that patients need to take away. So can you think about those 3 most important things from what to expect on their first visit with the nephrologist? Because that's kind of the beginning of their care.
Sure. I think number 1, please come. There's a reason why your primary care physician was concerned and wants an evaluation by a specialist. So make sure you come and see us. The second point is bring your medications. And it's because I need to see. Sometimes it's not clear from your records. Things may have changed and it's not been changed in your record. So seeing what you're taking really helps me understand what is your current medication regimen. You may also find out that you have a medication in your bag that, oh, I forgot about it.
Taking it.
Forgot about taking it. Or maybe, you know what, this one, it's on my record, but I'm actually not taking it because when I take that, I get a bad headache.
Yes.
So bring your medications. Even if it's not organized, we need to see your medications. And then the third point is to always stay in communication. I think there's nothing more important than feedback. I need to know what's working, what's not working. Don't wait for your next visit. Be engaged, be involved, be really part of the team. Again, you're the most important person of the healthcare team, and we're trying to help you. So communicate with us, use the portal, let us know if things go well. If they don't go well, just stay in communication.
Okay. Well, that wraps up today's podcast on what to expect at your first appointment with a nephrologist. Dr. Wiederkehr, this has been awesome. I thank you. You have really given us a wealth of information to share with our patients, caregivers, other professionals. So thank you so much for your time.
Thank you. It's been a real pleasure. Thank you.
Thanks for tuning in today. Learn more about Dallas Nephrology Associates at www.dneph.com. That's DNEPH.com. And if you found the information valuable, be sure to share with those who are impacted by chronic kidney disease.
Dallas Nephrology Associates DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.